Hey, Doctors of a Personal Injury Doctors Elite Community. Yes, it's the lively founder, Dr. Tony, your administrator, and founder of our doctors community. We're over the 4,000 member mark. Always thank you for your comments and advice for each other to help each other out and for the referrals that you have brought to our community. But today we have a special presentation, a lot of things that you probably are missing maybe in your practice, and that is the mental attitude of the patients or patients that are in car accidents or falls or personal injury will focus on. We definitely look at the physical aspects, the pain aspects from the neck, shoulder, knees, backs, and it happens. But sometimes you forget what these patients are thinking about and anxiety, depression, and a lot of other factors that you may not see in your examinations. And today we have a great professional. We have Dr. Christine Sauer, MD, ND. She's a German trained physician, and she has some great information that will help you all out in kind of closing down this loophole possibly that you may be missing that needs to be evaluated. And she has definitely some programs and some things that she can help you out with that we are actually bringing her into your practices virtually over the airwaves, I call it. So with this great technology that we have. A little bit more about her. She's written books. Some of them are #1 bestsellers, and she's a TEDx speaker. That has a lot of credibility. I'm trying to do that now
Go
with
for
some of
it.
the stuff I am doing. Her mostly focus is on coaching, and she's been out there 40 plus years. Hey, that's like me. And is an expert brain and mental health, gut, holistic healthcare practitioner. Dr. Christine, I am so glad to have you for our doctors today, and thank you so much for giving us tips and pointers and things that you can do for them to help them out that they probably not aware of. And that's why we're doing this for our doctors community. I'm going to go ahead and turn it over to you. Thank you.
Thank you so much, Dr. Tony. It's such a pleasure to present it to you and to the community of PI doctors. And I will open up a little presentation that will give you a little idea about what psychological injury after a personal injury, an accident or a motor vehicle accident can be, because it can cause invisible wounds. Now, how do I know? We help patients and heal and practices thrive through psychological injury recovery. And let me first introduce myself a little bit. Uh, like Dr. Tony said, I'm a German trained physician and a naturopath. I've trained as a gastrointestinal disease specialist, and you may know about the brain mind gut connection. I'm an allergologist. I'm a certified brain health and mental health professional. You might have read the book by Dr. Daniel Amen, Change Your Brain, Change Your Life. It is true. I'm a classic example. I'm, of course, a health and life coach. I train others. And I've been featured in several magazines, and I'm very happy about that. Now, I immigrated myself to Canada after a back injury. There you go, left me unable to practice nearly 30 years ago as a dermatologist in Germany. That triggered, you could call it a psychological injury, a suicidal depression. I got the standard of care, which left me disabled for close to 15 years until I pulled myself by the hair out of the swamp and rehabilitated myself. It was a long journey for sure, but I can say I know the issue I'm talking about today inside and out. My story is quite public. I've talked about it on my personal website, on podcast, and in my TEDx talk. I was fortunate to have the training, the knowledge, and this great husband here, Mike, thank you, on this picture, to help me to recover my sparkle, as I like to say. I became a neuroencoding specialist too with Dr. James McClendon, as well as a team therapist with Dr. David Burns. You can find most of my certificate and qualifications on LinkedIn and on my personal website. Now, that's enough about myself. I could talk for hours, but I don't. Important is the cost of psychological injury. It's enormous. In the USA alone, it's a significant economic burden, with various factors contributing to the overall expenses. And here are some key points. It's a few years old already. It's 2019. The cost of psychological injury after a personal injury in the United States was about $4.2 trillion, which includes the cost of healthcare, lost work productivity, and of course, the lost quality of life. The average medical cost of fatal injury was approximately $45,678 per hospitalized patient, while the average cost of non-fatal injury was about $7,800 per person per year. Now again, don't hold me to these. These are approximate figures and at least 5 years old. Probably now the cost is much higher. But it really highlights the substantial financial impact of psychological injuries on the economy, on businesses, on families, and on individuals, and it clearly establishes the need for more effective prevention and treatment strategies. And that's exactly what I want to talk about today. Let's first establish what a psychological injury is and why it matters, not just to patients, but also to their lawyers and their physicians after any personal injury. In short, psychological injury is a legal term for a mental trauma, and it is a consequence of an event or a series of events that can potentially cause long-lasting illness and disability. A psychological injury can result from any stressful events or a stressful series of events that the individual perceives as inescapable. And we will talk about the 4 conditions that must coexist for encoding a traumatic memory in the brain and causing lasting psychological injury in a few moments. Psychological injury after a personal injury is a mostly hidden problem, and many PI patients suffer from undiagnosed psychological trauma as the whole team focuses on the physical injuries. Psychological injury can manifest as chronic pain, PTSD, anxiety, depression, substance use disorder, and these invisible wounds are often overlooked, underdocumented, and undercompensated. Now, what's the definition of a psychological injury? Here's the official definition according to Wikipedia. A psychological injury is a psychological consequence of a traumatic event or a series of events. Such an injury might result from events such as abusive behavior, whistleblower retaliation, bullying, kidnapping, rape, motor vehicle collisions, or other negligent actions. And it may cause impairments, disorders, and disabilities. And it can exacerbate or destabilize pre-existing conditions. Psychological injury is considered a mental harm, suffering, damage, impairment, or dysfunction caused to a person as a direct result of some action or failure to act by some individual. What are the consequences of a psychological injury? Typically, a psychological injury, whether recognized or not, gets at some point diagnosed as post-traumatic stress disorder, residual syndrome after traumatic brain injury, post-concussion syndrome, chronic pain, or disorder of mood and emotions, such as depression, anxiety, fear, phobia, substance abuse, or an adjustment disorder. And these disorders may appear individually or together as a comorbidity. And if the symptoms and the effects persist, the injured person may become a complainant or plaintiff, initiating legal actions to seek compensation from the party responsible for the injury. Completely understandable. Here's a missed opportunity. because especially in personal injury cases, the coexistence of psychological injuries is often not properly documented or even completely overlooked. The claim payouts are often undervalued, and this can lead to long-term harm for the injured person and their family, of course, due to the financial hardships, but of course also to missed income for the physicians and lawyers who assess these injured patients for insurance purposes and then treat them after the injury. So, proper documentation and then treatment of psychological injuries that result from a personal injury are in the interest of patients, of attorneys, and of physicians alike. But it takes sometimes quite a lot of time and experience to do it right in the interest of everybody and achieve the necessary and desired quality and outcomes. Now, let's talk a little bit about the typical mental health consequences of personal injury. In the short term, patients may experience acute stress reactions, and it feels like insomnia, irritability, and emotional numbness. Often, the patients replay the event in their mind over and over and trying to understand what happened to them. But for many, these symptoms don't resolve quickly. They evolve into chronic conditions like PTSD, generalized anxiety disorder, major depressive disorder, or even substance use disorders. And these psychological injuries can severely impair a person's ability to work, to maintain relationships, and to enjoy life. Now, let me compare that with a ship on the water, because this is the big question that is often in the way. Why does not everyone suffer a psychological injury after a personal injury? And it's not as clear-cut as a personal injury. Physical trauma is relatively easy measured. You broke a hand, here's your x-ray. It's much harder with psychological injury, since often a claim-seeking behavior of the injured person is suspected or even present. And the reason for the difference lies in 4 major factors that I'd like to show you in the next image. And this will make it obvious why similar objective events, like a broken hand, may affect different individuals in very different ways. Now, here's a graphic by the founders of Havening Techniques, my mentors, Dr. Stephen and Ronald Roden from New York. It shows clearly the 4 requirements for traumatization for psychological injury. Because to produce a psychological injury or a trauma that lasts, the event needs to become encoded permanently in our amygdala, our brain. And Dr. Roden identified these 4 requirements. Number 1, of course, the event. In our case, the personal injury, psychological injury, or series of injuries. Second, the landscape. This is like the ship in the ocean in the previous picture. And depending on our patient's history, the family upbringing, the education, the genetic disposition, even on lifestyle factors like the work environment, nutrition, past and present illnesses, relationships, all this can create a vulnerable or a resilient landscape. Then, of course, there's the meaning we assign to the event. This is a cognitive process, but it is greatly influenced by words and emotions. For example, one individual may assign this meaning to a broken hand. Oh no, I broke a bone. Well, I'll be inconvenienced for a while, but I know that it will heal and I will be okay. While another person may say, this is terrible. Why did that happen to me? This should have never happened. This is so unfair. Why me? I always get the short end of the stick. Of course, This dialogue often goes only on in our head, and often it is not expressed or even not conscious to the affected individual. And then the last factor, it's very interesting, is the perceived inescapability. The event must have been perceived as unescapable. Being trapped in a motor vehicle accident is a typical and a common example. But even childhood trauma is a good example, as children are dependent on the adults for survival. You can extrapolate to an employer-employee relationship if you want to. Now, how do we now help these patients achieve permanent recovery? The answer lies in a multidisciplinary approach. We need to calm the storm, and physical rehabilitation must be paired with psychological care. And evidence-based therapies like cognitive behavioral therapy, like team therapy, and EMDR or havening techniques, somatosensory techniques, are effective for trauma-related symptoms. Pharmacotherapy may also play a role, especially for depression and anxiety, and may be helpful, especially in the short term. Now, as physicians, what is our role? Our role is to identify these issues early, to document them clearly, and to refer patients to appropriate mental health professionals or expert brain and mental health coaches who have specialized training in these techniques. I personally have seen excellent results with a combination of havening techniques, cognitive behavioral strategies, bibliotherapy, and logotherapy, in addition to targeted supplementation and brain rehabilitation. So we must be sensitive to this trauma-informed approach and be sensitive to the emotional impact of injury, and try at least to avoid re-traumatization if possible by recognizing and clearly documenting malingering. Now, in the legal context, and I'm not a lawyer, please don't get me wrong, but our documentation as physicians can support the patient's personal injury and psychological injury claim. Objective, clear, and clinically grounded reports are essential. We are not advocates, we are medical professionals, but our insights can help ensure that patients receive the support that they need to permanently recover. Expert coaching can integrate the advice of all professionals and make long-term recovery more likely. And finally, we must empower patients and encourage them and enable them to work towards resilience, towards self-efficacy, and towards long-term mental wellness. I always say never give up, and it's true. So how do we help patients achieve this permanent recovery? The answer lies in a multidisciplinary approach. We need to calm the storm, and physical rehabilitation is paired. The role of physicians, I addressed that, must play a role. As physicians, we need to address it. The legal collaboration, the expert coaching, and the patient empowerment, it all needs to be packaged in a clear, helpful package that is targeted towards achieving the permanent recovery that everybody, including the patient, desires. Now, here's a solution that we at the Psychological Injury Recovery Institute offer that I founded. We put the resources in place to provide computerized and expert online cognitive and psychological injury assessments via Zoom, via digital individual and group recovery programs, and we provide the pertinent legal documentation in collaboration with other professionals, of course, as required, as part of a psychological injury recovery strategy. And here's how it works. The first step, you refer a patient, and I'll give I'll give you a URL that you can go to and enter the information. We assess and support them. You receive the results and a referral fee. There's no extra administration burden. It's ethical, compliant, and it is effective. So, in summary, why should you partner with us? You will achieve better patient outcomes. You can achieve higher value settlements. The referral incentives that we are giving are nice. There's no marketing fluff, just expert medical support, and you can join our mission to heal invisible wounds and elevate care. So here are your next steps. If you see that slide and you have your phone with you, point the camera to the QR code and it will send you to the website. Here it is, psychologicalinjuryrecovery.com. And let's book your free consultation. It shows you whether you're a patient, whether you're a client, or whether you are a provider. There's 2 different forms. Let's explore how we can support your patients and grow your practice together. Now, I promised not to take too much of your time, and I hate long, boring presentations. I want to end with a very warm thank you for listening so far and for caring about the invisible wounds of your patients. There, Dr. Tony.
That was absolutely great. Let me bring back my picture. And yes, doctors, I like the invisible wounds category. That is great to see. You know, many of you have the whiplash patient, the concussion patients, and everything Dr. Christine has mentioned. Sometimes you are missing the evaluation because you're going more physical. So this is something that was brought to my attention by a couple other factors, and so I wanted to find a good professional doctor. And I love her accent, the German accent. We like that.
Thank you.
So we're going to bring her right into your offices as part of your practice. And so you have to just contact her, make a contact 101. We'll have everything posted on this endorsement that we're bringing into our doctors community for her information and services. And obviously, the best thing to do is go 101 and go over the patients or any of the factors that you need for her. Just to add, she pretty much covered it. In a personal injury case, obviously, you need to document the condition in your document notes that is related to the accident. That will either go to the third party liability that was at fault or the attorney representing the injured party, because they need to evaluate that particular situation for settlement. And this will include her services and the services that is needed based on your documentation. It was needed to be included. If you don't keep it into the accident related situation, then pretty much so the defense will throw it out. So just some things that I've learned over 40 years of personal injury. You need to document it as the doctors, and she will also document it with you for your patients and people. There is codes. Couldn't put the codes in the presentation, but the codes, if you get with me 101, we'll give you the codes. They're educational codes that are used from our billing specialist, and you can send them out in a patient's automobile insurance MedPay that usually pays those. Health insurance may or may not, but all in all, if it's in a liability case, you put it in the health costs that's the services were related to the accident, and down the line you'll get paid 101. And anyway, that's what I wanted to add. So you evaluate your patients physically, and now you can evaluate mentally. Dr. Christine has a good evaluation program that they can fill out and do, and your office can do, to find those elements out real quickly and then make a move in your treatment plan. So just a few practical things to make it easy for you to use her services. We have her now into the community. She will be floating around our community to answer questions, make comments, to contact you for her services. So welcome her in as a great professional, Dr. Christine Sauer. All right, Dr. Christine, do you have any more to add? That's a lot.
No, I'm so excited to be able to offer that. And yeah, please contact me. I don't bite usually.
All right, great. So we'll have everything there, all the information to contact her. And so make sure as of the next couple of days when this goes live into the community for a while, we have her information. You can contact her. So, all right, with that, we'll send you on your regular rounds back to your patients and your staff. I know they're waiting for you, and we'll go on. We thank you for your attention, your being able to watch our endorsement today, being on the PI Doctors Elite community. Thanks for always for your membership. All right, Dr. Christine, thank you so much for your time, your education, experience, and hopefully a lot of our doctors will take advantage of what you can offer to help them out. Dr. Tony, your administrator and the founder of our PI Doctors Elite community. We're heading towards that 5,000 mark in membership, but stay tuned for more events and more things that we can bring you right in the virtual presentation elements. All right, take care, make it happen, stay healthy. Thank you so much. Hey, this session is now ended. Thanks, Dr. Christine. See you.
Yes.